I can start and then Pau can jump in and help me out. So first of all, why behavioral science needs to be de-WEIRDified? I think behavioral science is a like if you take prospect theory, the seminal study from Kahneman and Tversky in the 70s, it has already like 50 years. But if you want to take a closer date or highlight, if you want to take, I don't know, the creation of one of the first public sector behavioral insights units, which was in 2010 or around 2010, behavioral science has already like what, I don't know, 50, 20, 30 years of track record, right? So we've achieved like a certain level of maturity and we've learned a lot and we've had successes, mistakes, but I think we've reaching that point where the field is mature enough and we are finding some limitations to this amazing, amazing field. And one of those limitations is that despite behavioral science is popular and is increasingly more popular, we are finding a pattern of that majority of evidence or efforts or applications that we can see, at least in the evidence, in the formal evidence or channels of evidence that we're finding, comes from specific geographies, right? So for instance, if you take a look at the number or the cumulative number of government behavioral insights units that have been created up to 2023, there was like 142 behavioral insights units, which is great. It's a great news. It means that a lot of governments or teams and people are seeing a lot of value in this. But then when you take a look at where these units come from, you'll see that the majority come from the US, the UK, the Netherlands, Australia, Canada, I don't know. And when you see how many of these BI units or teams actually come from other geographies with different cultures, different values, different norms, the number kind of shrinks. So that's an issue. And actually, if you take a world map and you scale it to the population, you'll see. So this is a world map, but just scaled to the number of people that live in each region. And you'll see how the map changes, right? So for instance, India gets very big, China gets very big, Africa kind of remains similar, but then you'll see that South America kind of disappears, shrinks. It means that there's very little people living there, of course, relatively. Europe, kind of, the US, you'll see that similarly to that. Now, let's do the same exercise. What happens if you take a world map and you scale it to the published research? Right? So how many published research each geography contributes to the scientific world? And see what happens. It's kind of crazy. Africa almost disappears. Europe gets like disproportionately big. The US or North America gets disproportionately big. So this is an issue not only in behavioral science or psychological sciences, but in sciences in general. I think there's an overrepresentation of science in specific geographies and countries, which is not proportional to the number of people that live in those countries, right? And I know this is a proxy. I'm not saying that this is a perfect metric, but this is a proxy. And a few years ago, someone called Heinrich came up with an acronym called WEIRD, which Paula is going to describe a little bit better and tell you what is it about. But basically, he did an audit of what the psychological sciences had studied so far. So, Pau, I don't know if you want to tell us a little bit more about this acronym.
Yeah. So basically, the first perhaps statement that we want to highlight is that weird people generally are outliers. So as we've seen in the maps that I just presented, we have a lot of evidence and a lot of research being done in countries that proportionally actually represent a small minority of the global population. So the main problem here is that behavioral science, as well as so many other disciplines, are disproportionately kind of studying a specific type of population. And naturally, because as researchers, we always look at evidence and we look at papers and we really try to understand, what body of information exists before we tackle any challenge, we are consistently going to find bodies of information and knowledge that come from one specific type of population. And this population is weird, which I'm sure everyone is very familiar with this acronym. But to put in simple terms, it's Western, it's educated, it's industrialized, it's rich and democratic. But what does that mean? It means that people from weird societies reflect social norms, mainly from societies in Europe, from the United States, from North America, from Canada. So the social norms that we study come from very specific countries. They're generally very educated. So we're talking about populations that have access to formal education, to universities, to colleges. And many times samples that are used in these studies are actually students themselves. Obviously, because of availability bias, because researchers are trying to make do with what they have, many times the samples that are used are students in universities, are people with certain levels of literacy that do not necessarily reflect literacy across the globe. Assumptions that are kind of built in, maybe even unconsciously or taken as defaults, are assumptions that are kind of framed and reflect a certain type of economy that may reflect market dynamics. And the people that we study again, and the people not only that we study, but the people that design research protocols, that conduct research, tend to come from societies that are high-income countries. And these are people that are, used to certain services. They have, financial services ready available. They have good transport services. So there's just a lot of existing factors that they take as default, that they take as norm, and that we're studying in that way. And of course, democratic. So worldviews are our perspective of society, of what rights mean, of what individual agency means, certain values that we may hold dear because we grew up in certain democratic societies organized politically in a specific way. These things, these defaults, these worldviews, and these conditions will naturally come out in our research subjects in the way that we also tailor and design research protocols. So, as I'll just mention, Joseph Henrich is the person who coined this term back in 2010. And basically what he wanted to understand was, where is all this evidence coming from? The evidence that we use, sorry, my cat, in behavioral science. And basically he found what we all kind of already know, is that North America and Europe, research from these geographical areas in the world, really dominate kind of the body of evidence that we use in our work. An interesting fact, 82% of both first authors and research samples of the top psychology journals come from these regions. 82%, it's just a starking number to think that all the evidence that we analyze and take into account when we're trying to understand a problem area is coming from just these two relatively small regions of the world. Now, Africa, for example, just to kind of reflect on the maps that all showed us previously, Africa represents 18% of the global population, but contributes less than 1% of the samples in these same journals that Joseph Henrich analyzed. And how is that, how does that impact the evidence that we're looking at? One very clear and interesting example for anyone who's done research in and around children, designing, interventions or services for children. Something that Joseph Henrich found was that European and American children are more motivated when they choose from themselves. So individual agency is important for small children in Europe and in the United States and Canada. But for Asian children are actually also motivated when trusted adults choose for them. Now, if we're studying any problem in any region of the world, and we consistently find evidence to show us that small kids want to make decisions on themselves by themselves, that's a bias that we will naturally integrate in the way that we think of the solutions that we want to design for children broadly, independent of where we are in the world. Next up. Now, this is a really interesting study done just a couple of years ago, and I'm sure everyone can relate to kind of this desire of understanding how AI works. But these researchers, what they did was they wanted to answer a very simple and exciting question, which is, if ChatGPT had a nationality, where would ChatGPT come from? So basically, they designed a study where they compared ChatGPT's responses to other data sets and other bodies of knowledge. And they ran three concrete tests. The first one is that they use the World Value Survey, which I'm sure a lot of you are familiar with, but it's an enormous data set that represents answers from all over the globe to understand society's perspectives around key issues and values and societal norms. And they compared the answers of ChatGPT to the World's Value Survey. One task. The second task they did is that they analyzed the thinking style of ChatGPT. So basically, they asked ChatGPT to complete a test where they analyzed what type of reasoning this AI has. So is the reasoning more analytical or is the reasoning more holistic? And the third task that it asked ChatGPT to do was it asked it to describe how an average person might solve a certain problem, might answer a certain question. And based on the analysis of these three tests, researchers were led to a very obvious conclusion, if we look at the graph on the right, is that ChatGPT, if it had a nationality, it would be from the US. So the correlation between ChatGPT's answers and kind of the cultural reflection of a society is very similar and correlates very strongly to being a person from the United States. Followed by Canada, Australia, Singapore, Great Britain, the Netherlands, and very far to the right. So the country that would very least identify with being, or the country with whom ChatGPT would least identify to being from, would be countries like Jordan, Egypt, Pakistan, etc. So this might not be a surprise to most of us, but it is certainly exciting to start to see some evidence that shows us that AI and these groundbreaking technologies that are shaping the present and the future are really kind of mirroring a bias that is very weird.
It's kind of crazy. Like we use these LLMs all the time to help us with work. And if you think about it, it's almost like imagine that you're working in, I don't know, in South Korea, right? And you're trying to, or in Pakistan, you're working in Pakistan, and you ask ChatGPT, hey, what do you think I should do in this situation? And it's like asking a US person about a situation in Pakistan. So I think anyway, and that's a rabbit hole. So we're not going to get into that, but I think it is food for thought for sure. So people are nuanced, and behavioral science is nuanced. And I think there are a lot of great frameworks out there that we have used, but I think it's time for us to find the nuances in the framework as well. Or at least if we're using the frameworks, I think it's important to acknowledge that there might be some nuances here. So for those who are not so familiar with this field, one of the most popular frameworks that behavioral science has is EAST framework, right? Developed by the Behavioral Insights team, which is an acronym for easy, attractive, social, and timely. And basically what they're doing is saying, hey, every time you are thinking about an intervention, if you want to make it behaviorally informed, you have to consider these four big categories. Make it easy, make it attractive, make it social, make it timely. And BIT is not saying this is the only thing that matters. They know there are nuances, but of course, it's a way to kind of popularize and make the application of behavioral science easy. But the problem is that when this is what gets socialized, a lot of people might think this is the sole truth, and as long as you apply the EAST framework, everything is going to be all right. And I think as a field, we are achieving that level of maturity where we can start socializing a little bit more about the buts, right? The nuances of applying these things. So I'm also aware of the time, so we're going to try to move a little bit faster. But what we're going to do is to show some nuances. And again, we are not saying that EAST doesn't work. EAST is great and we apply it all the time. We're just trying to show the nuances and how careful you have to be when applying EAST in different geographies. But again, moving a little bit faster, there are some studies that suggest that there's a big difference between West and East Asian societies, being that the West is more analytic and tends to look and focus more on the individual things, while as in East Asian societies, we tend to be a little bit more holistic and we tend to take into account the environment more. So there are several studies that have tried to prove this. For instance, in this study, they compare how East Asians, I think it was Japanese, analyzed different images compared to people from the US. And basically, they show different images of fish and nature and so on and so forth. And they ask them to explain and describe what's going on in those images. And what they see is that people from the US focus much more on describing like specific subjects, such as fish, this fish is leading, this fish is swimming, and so on and so forth. And then Japanese people tend to describe much more the environment. And it's interesting because then the researchers change some things and they ask participants to kind of try to remember what they saw. And Japanese participants are much worse at remembering correctly what they saw when they have changes in the environment. So, for instance, if they get a question about how many fish they were they in image number 4, but they changed or manipulated the environment of image number 4, the accuracy of their remembering correctly falls much more. Just because researchers hypothesize because Japanese people tend to look and remember things holistically, also considering the environment. So when you change the environment, it's much harder for them to remember correctly. So there is some research that shows this. So, and the question to me or to us was, okay, let's make things easy. But the question is, what does easy mean to different societies and cultures and geographies, right? And I'm gonna bring an example from my childhood, which is, this is Google. So every time you open Google, this is great, right? And if you take a look at what a good UX practice, user experience practice is worldwide, is keep it simple, right? Don't give too much information to users because you're going to overwhelm them and they're not going to know how to choose correctly, right? So this is the beacon of a good UX. Now I'm going to share with you what the most popular search engines platforms in South Korea looks like, which is the search engine that I've seen all my life because it's the search engine my parents used even after moving to Argentina, which is Naver. And it is very clear the difference between one search engine and the other search engine. So every time we think about making things easy because it's a good behavioral science practice, the question that we need to start asking is easy for whom? In which context? In which culture? Okay? Because apparently Koreans don't love when you just give them this simple thing. They prefer something like this. Oh,
Cool. So now let's look at attractive. Again, very similar point. Attractive doesn't mean the same for people in different contexts and different cultures from different countries. So this is a really interesting piece of research that was done in the US, in a university based in the US. But what they wanted to test was to what extent is a certain behavior that is being promoted more attractive if the messaging changes. So what they did was say, well, we want to test game frame, so framing a message based on the benefits of that behavior. And we also want to test loss frame, so framing the attractiveness of a certain behavior depending on the risks of not doing that behavior. And the specific behavior that they wanted to achieve was flossing your teeth, a very simple behavior that has very two clear ways of being presented. So what researchers did was that they took their sample and they broke them up into 3 different groups. One group was shown the game frame. So what are the benefits of flossing? One group was shown the loss frame. So what are the risks of not flossing? And then, of course, there was a control group. Now, the interesting thing here is that what they wanted to do is to understand the influence of culture. So when they designed their sample, they chose people based on how close they are, how familiar they are to US culture. So for example, students that had 2 parents that are from the US and that they grew up their whole life in the US would be put in a group that was, very culturally attuned to the US versus students that perhaps come from, have parents from different countries, or perhaps, they're exchange students and they've only been in the US for a year or 2. And based on that cultural affinity, they were also classified. And what researchers found was that the more that they were able to match the message to the culture, the better the ultimate kind of output was, which was to achieve, to achieve that students would actually floss their teeth. So they exposed students to all the messaging. A week later, they tested recall of the messaging. They asked them to, did you floss your teeth? How many times a week? And what they found was that students with kind of lower cultural affinity, so students that were less exposed to US culture, they preferred a loss frame. So a loss frame, a frame around prevention, was more effective in getting this group of students to floss their teeth. However, what they found with students that come from, high cultural US exposure, meaning, students that perhaps both parents are from the US, they grew up there their whole lives, they realized that these students responded way better to gain framed messages. So messages around promoting teeth flossing. And generally, this is just a great study to kind of really reflect the fact that culture is huge in influencing, how we're more attracted to make certain decisions and what really just works best in our decision-making process.
Then the third category is social, and probably you've heard and you've read about the one of the most classical or popular behavioral interventions, which is, hey, we want more people to pay their taxes on time. That's how governments finance whatever they're doing. So in the UK, one of the most popular interventions was in the letter that we send to taxpayers, what happens if we use social norms and we say something like, hey, 9 out of 10 people pay their tax on time. So what they saw is that actually a lot of people started paying their tax on time just because they added this little sentence, right? Hey, the majority is doing this, so we should do that the same. And this experiment was replicated in a lot of countries. This was widely popular because imagine the cost effectiveness. Just by adding one sentence, you are bringing forward the payment of 210 million pounds in just a year. So interestingly, this experiment was replicated in Argentina, in a city called Junín. And in, in the letter, they said something like 7 out of 10 people pay their tax on time, trying to see if that increased the tax payment on time. And no surprise, it backfired. It is the only letter that not only had no effects, but backfired. Had people that received those letters paid less taxes, at least on time, than even the control group. And I love this example because if you take 100 Argentinians and you ask, like without any scientific or behavioral science knowledge, if you ask them, hey, do you think this is going to work? They're going to say, no, that's not going to work, right? So there's a very interesting and important cultural component here in behavioral science. But if you are from, I don't know, from the UK and you don't really know the Argentine culture and you just come and say, hey, the evidence says that we should use social norms, 7 out of 10 is the majority, let's use social norms, this is going to work, that would have been a big, big mistake, right? And then lastly, timely. Where's to you, Pau?
Yes. So timely. Basically, here the big takeaway is time is also relative. The perception of time, our perspective of future changes depending on our cultural context and also just depending on our historical, political, economic context. So I think you saw very briefly in that video, there's the image of a very well-known experiment, which is extremely fun to watch and very cute because basically they give small children a marshmallow and they ask children to, you can eat the marshmallow now, or you can wait for me, the researcher, to leave the room and come back. And if you're able to not eat the marshmallow, I'm going to give you a second marshmallow and you'll have two marshmallows. So if you look this up on YouTube, it's super fun because you see all these children, very small children, struggling to not eat the marshmallow. And you can see their frustration and their attempt to really tune into their willpower. Of course, some end up eating the marshmallow and some are able to, they suffer quite a lot, but they're able to wait for the second marshmallow. Similarly, this study, what it does is that it conducts an experiment in China and Chile. And these experiments are delayed discounting tasks. So basically what they do is they ask participants to either choose between receiving a small reward now or wait a certain amount of time to receive a larger reward in the future. Now, one finding that may seem obvious, especially to anyone in Latin America in the room, is that Chilean participants placed much lower value on that delayed reward, and they were way more kind of likely to prefer obtaining the immediate reward. And of course, this might seem irrational because why wouldn't you just wait and get a bigger reward? But the reality is that it's not irrational. It's very contextual. So anyone who lives in the Latin American region knows that in Latin America, waiting for the future is actually can be a lot more riskier than anyone else would think. Our political context, our economies, social upheavals in our countries, our abilities to react to, as we know, sadly now, to natural disasters, really makes the future generally seem very unpredictable. And so waiting for a reward in the future can actually be way more risky, especially if you're comparing it to countries that may be generally more stable, or where the future feels something that you can plan for.
So again, present bias, which is a very widely popular behavioral or cognitive bias, it depends when and where, right? So we're not saying that we should criticize and the cognitive biases are not universal. And there's some debate, probably they are, but we have to be careful and we have to contextualize the behavioral interventions depending on the culture and the society and the time, right? So the question is, how can we de-WEIRDify behavioral science? How can we make behavioral science more global or inclusive of these different nuances? And the first question that we ask ourselves is, hey, are there like more researchers or people like studying this and trying to come up with frameworks? And there are some journals or studies that show that there has been some progress. For instance, they have taken like published research and taken a look at where the sample comes from. And what they see is that in the last few years, there has been some progress in terms of including more sample from non-weird societies, but still, like for instance, in 2024, 60% of the sample still came from the US. So still the majority of the sample that the research is using come from the US, but we are making some progress, but not enough. I think that's the key message. And also, I think there are some researchers trying to show and come up with different hypotheses on how to better explain this heterogeneity in effect sizes when we are replicating behavioral insights. Heterogeneity in effect sizes in behavioral insights is just a very fancy way to say you've got very different results depending on where the intervention was tested, right? So there's a great study from Eric Johnson. I think he's at UCLA. I'm not gonna explain it in detail, but he comes up with different frameworks or a different hypothesis of a framework about how to explain this heterogeneity that we're seeing. So just because of a matter of time, I'm going to jump into showing what we've thought, and we'd love your thoughts and input here. We've come up with a framework, and we know it isn't perfect, and it doesn't substitute the existing frameworks that there are. It's just a complement to other existing frameworks. East is great, Combi is great, but to us, at least, those two frameworks don't really make so salient and attractive and timely for us to check on certain specific things that are important when you're replicating behavioral insights into non-weird geographies or societies. And we've come up with these 5 big checklists. Think about the power, think about the local systems, the agency, the contextual history, and the evidence. So very quickly, we're going to go through this. So when we think about power, the first question that we need to ask is, hey, when you are working in a behavioral science project, ask 2 questions. Who designed this, or who is the project team, and whose voices are absent in this, right? And there's a study from Sherry Arnstein. Sherry Arnstein was a researcher that also worked at the US government in the 60s. And in the 60s, in urban policy in the US, one thing that was very popular was doing public consultations, citizen participation. Hey, what about if we ask people, if we ask residents how cities should be designed, planned, and implemented and redesigned. And they started doing a lot of citizen participation, citizen consultation. But what she noticed is that a lot of these consultations were tokenistic, were just almost like a show, because in reality, the outcome of what the urban policy was didn't really change after the consultation. So she then developed like a whole theory and framework. But the key question here is, hey, are we really taking into account the community's insights and voices, or are we just doing whatever we want and just checking or ticking a box of, oh yeah, we co-created with the community, right? So what we recommend is there are some signs that you should look out for, and then some questions that you want to answer, and then some possible redesigns or design responses, such as, for instance, adding veto points, giving more power to the community that you are co-creating with, to really make sure that their voices are represented in the behavioral intervention that you are doing, even though it may be conflicting with the weird evidence that you've got, right?
Now let's look at L, local systems. So basically what we want to look at here is, to what extent is this new programming, this new service, this new product attempting to replace something that already works? So the big highlight here is, how do we acknowledge that usually societies don't have vacuums, they have spaces that have been filled by local systems that may be informal, but that occupy a very valuable place and space and role within society. So one great example, which I think will resonate just across the globe, is the role of informal financial systems. In this study, researchers were trying to understand ROSCAs, which is a name for a very well-known financial mechanism, which are these kind of rotating savings and credit communities, where local communities get together once a week, once a month, and each member of that rosca, or in Peru, we call them banderos, will give a certain number of money on that specific date. And on every date, one person from that community will take, the whole bundle or the whole pot of money. Now, this informal financial system exists almost everywhere in the world, with different names, with similar mechanisms. And in this piece of research, it's very interesting because researchers, they focused on Kenya, and they really wanted to understand, why do individuals keep participating in these rotating saving systems, despite the fact that formal financial systems already work, despite the fact that these financial systems are, they're informal, they're not regulated, they're risky. Sometimes they're very inflexible because you have to show up to every meeting with a specific amount of money. And they wanted to understand why. So basically they did, surveys, in-depth interviews. And the most interesting finding was that, this kind of coercive, to give it, an adjective, this commitment mechanism whereby everyone had to give in a specific amount of money on each meeting, even though it may seem coercive and it may seem inflexible, it was actually valued as a great commitment mechanism. So it was highly, highly valued. Essentially at each rosca, each participant was kind of called out by their name. They went to the middle of the circle or in front of the whole group, and they had to give in their money. And if they didn't have the money, they would receive a lot of social reprisals, and there would be a lot of pressure from their own network, from their local communities, from their friends, from the family members that may also participate in the same group, to pay up. So there was really just strong kind of social network pressure to really commit to giving that specific amount of money on that specific date, and that was very, very valued. But an additional commitment strategy that I personally found very interesting is that some Roscas also had spending agreements. So that meant that Rosca members were held accountable to use the money in the way that they had said that they would use their money. And the rest of the Rosca members would kind of fiscalize and hold them accountable. And what this allowed, in this case, women, because the study was done on Roscas where their main participants were women, this allowed women to actually use the money for whatever it is that they wanted to use. And in most cases, this money was used to reinvest in their small business. And they reported to feel because of this agreement, they were able to kind of protect themselves from the pressure of their family members, of their husbands, to use the money in some other way when they received this bulk amount. So as we can see, clearly this informal kind of financial system was playing an important role in the society based on the different kind of social pressures and risks that there were to saving and how to use those savings. So similarly to what I'll just presented, we have different warning signs that we should look out for when looking for, when trying to understand local systems, questions that we should kind of keep ourselves accountable for as researchers to ask when we're trying to understand informal systems. But overall, these design responses also work as design principles. So generally, kind of some rules of thumb when we're looking at local systems is to try to always build through existing systems, try to strengthen existing systems, and avoid kind of creating these parallel structures that may compete with mechanisms that are already trusted, they're already valuable, and they're already completing an important task within that specific community. And now I'll go quickly through this because we don't have a lot of time, but A is agency. So here it's basically, always trying to understand to what extent are the people that we want to take a decision able to take that decision? So are these decisions individual decisions or are they actually collective decisions? What are the social risks associated to a specific decision that we want to promote? To what extent are people prone to act out of fear, to act out of pressure? So this study, which is an example of how gender dynamics kind of play into decision making, was really interesting because, just to put it really simply, what they did was that they conducted an experiment in Lusaka, Zambia, and they gave about 800 women a voucher to use a family planning service. Through the voucher, they would be able to access contraceptives and advice from a trained nurse. Now, half of these women were offered the voucher on their own. So just, the nurse offering a voucher to a woman in privacy. And the other half of these 800 participants were offered a voucher as a couple. So the couple, both the man and the woman, were offered these vouchers. And what they found was that women given access with their husband next to them were 19% less likely to seek a family planning service. However, women that were offered these contraceptives, these voucher alone, were significantly higher. They had significantly higher uptake of reversible contraceptions like IUDs and implants. And generally, what we found in this study is, hey, there's a lot of gender power dynamics that we have to take into account when expecting a certain person or a certain group of people to make a decision. And to this, again, the same structure, I won't go through all of them. But again, the design responses or design principles that we thought were important was always design for privacy and safety, and really try to think of, are we doing individual nudges, or do we really need to think about the household, the community, the family, the couple, when we think of how to influence behavior?
This one is important because behavioral science a lot of times over focuses on, hey, we have to focus on the person to change their behavior, and a lot of times that person doesn't have the agency to change the behaviors because of other factors. So it's like, hey, are you making sure that even if we make the best intervention possible, the person is going to be able to change their behavior or not? And then almost lastly, contextual history. And I think this is similar to the experiment I showed you in Argentina, where it backfired. You have to really understand the context and the history and the institutions. So one really great study that we like is between the 20s and the 50s, there was like a big and huge treatment campaigns against sleeping sickness, which is this sickness that is transmitted by the tsetse fly. And there was a big campaign to kind of eradicate this in Cameroon, Chad, and other countries. And the problem with this treatment or the mass campaign is that they used a little bit toxic medicines to kind of treat this. And a lot of times the medicines had even higher negative consequences than the disease on itself. And a few researchers like a few years ago, what they did is to kind of understand if there was some relationship between those regions in these countries or those communities in these countries that received an intensive treatment campaign and the lack of trust to the health system like 15 years ago, right? And what they see is actually that's the case. So they see that those regions that were more highly exposed to these campaigns in the 20s, in the 50s, now like 70 years ago, they are more or less trustworthy about to the health system. And what they see is that, for instance, in a blood test campaign, they refuse much more, up to 5% more than the control group. So you really have to understand that it might not be a matter of the messaging that we are doing or the behaviorally informed communications that we are doing doesn't work. Maybe there's some contextual history that we have to take into account before rolling out our interventions, right? And finally, the evidence. Evidence, I think we've explained it quite a bit as well. But one thing that I want to highlight before wrapping up in terms of evidence is, look, the majority of the evidence that is out there comes from weird societies, and it's hard to kind of find the right evidence from other societies, and specifically if you're working in other geographies, right? We're doing a project in Timor-Leste. It's very hard to find like published evidence in the American Economic Review journal in Timor-Leste, right? So you have to be comfortable managing or navigating local or gray literature first. And then the second thing is, a lot of times the validated outcome measures that we use to measure our behavioral interventions have been measured in specific, again, weird societies. So also be very careful on which type of outcome measures that you're using and whether those outcome measures have been tested and adapted to the specific geography that you are working on. And so just to wrap up, and now we would love to chat with you. Sorry, because we have only 10 minutes left, but we're not saying that everything that we've built as a field should be ignored or should be eliminated, or we should come with a new lens that replaces the weird lens. What we are saying is we should try to come up with frameworks, tools, checklists, ways, mechanisms to make sure that we are not only replicating this issue of weird behavioral science and try to build mechanisms and commitments to help make behavioral science a little bit more inclusive, or that it takes more into account the different contexts and societies that we are working on, especially because we are advancing as a field. And I see there are a few questions, but opening up the mic.
Thank you so much, and Paula. That was a lot of information to take in. I think that lots of people are asking for the presentation as well. We had to rush a little bit, but we want to take a couple of questions from the chat first. We had some questions prepared, but I think that the participants are more keen to hear from you. We have here one, I don't know if Paula or you want to take it, is communities may have unrepresentative, unhealthy power structures. So how would you ensure consultation isn't just talking to the most powerful within communities? For example, not getting enough women representation, teenagers, adolescents, etc.
That's a good one, and it's a hard one. I don't think there's a magic solution on how to make sure that you are making sure that you are not only inviting those with more power or higher voice to the co-creation groups. We're a small team, so I'm gonna talk from our personal experience. What we always try to do is to look for local partners that know the field better than us, especially because we work in fields that we might not have a person or a team member there. And we kind of trust that organization into trying to recruit those voices that might be the less represented or try to include more. Of course, there are ways and small nudges and mechanisms that you can have to ensure that you are really truly being inclusive in having like a good representation in those co-creations, such as asking things as, hey, gender, different religions, different socioeconomic levels, and how are you doing the recruitment of these participants? So just having like a quick checklist of different things that you want to check to make sure those things are represented there is a way. Of course, it's not a bulletproof kind of solution, and it takes more time and resources. So you also have to, maybe in the planning phase, consider that it will take you longer and it's going to be more expensive to do that kind of task. I know, Pau, if you have a better answer than me.
No. Just to add to that, I think something that's worked really well in the past that does require more time, and that should be built into project timelines, is to build an advisory group. So basically try to have an advisory group that represents different organizations that are already working in your field, right? So like especially when one is an international consultant, you go into a different context. And I think the humbleness of really knowing that you know very little, doesn't matter how much experience you have in other countries, like of that context, you know very little. So really designing an advisory board where you take representations from organizations that are already working on that issue. They're already trying to solve that problem, and making sure you have checkpoints at very strategic moments within a project cycle, especially moments where they can influence decision-making on sample sizes, on how to approach communities, how to really organize fieldwork so that we can take into account power dynamics that we as international consultants are not aware of naturally. So I think that's something that's really worked very well in the past, but the main thing there is really recognize that it's going to take more time and you need to build it in.
Thank you, Paula and all. I don't know if we have time for one more question. Maybe to quote what you mentioned in one of the slides, all here Charles is asking, as you said, 82% of the evidence in top psychology journals come from Europe and North America. That map was actually quite fascinating to see the disparity on population versus it's not proportional. So Charles asked, how confident are we that the behavior theories developed from this evidence are applicable to African populations? And what do you suggest can be done by researchers to correct this evidence gap? I don't know, Paolo or whoever wants to take that one.
I try to be very pragmatic. So I think some evidence is better than non-evidence. How much of these theories are really replicable into Africa, into East Asia? I don't know. We'll have to prove it. We'll have to test it. And what can we do to correct this evidence gap? I think the Global South Behavioral Science Group, us meeting and trying and exchanging ideas and then going back into the field and building evidence. If you're doing something cool, applying behavioral science in a geography that is underrepresented in science, publish it, go share it, talk about it. I think we need more people talking about when behavioral science does not replicate in your own geographies. And that's how we are going to really become a more representative science or field of the entire population. It's a long and tedious and effortful task, but I think that's the way to kind of reduce the gap. And I fully agree. Like, I think there are a lot of theories. My parents are Korean, so I grew up in a very East Asian culture and household. And I think that I read a lot of things in behavioral science, Western behavioral science, that I think this is not applicable in East Asian societies, like boundaries. Like, ask teenagers to go and consult and have boundaries. Like, what boundaries? Like, I didn't grow up with boundaries. I didn't even have doors in my house, right? So I think I can definitely relate to some theories not being applicable. I think the only way to really solve this is by us building more evidence and sharing with a wider society or scientific community. But I don't know if there's,
No, I think we're running out of time. The only thing I would add is that we really need to place kind of more legitimacy to findings that are not published. I feel like sometimes that publishing bias works against us, and really having deeper conversations, again, with people on the ground that have been trying to solve these issues, that can probably inform us much better just through their own lived experience and frustrations than what we may be informed by through only academic papers.
Oh, and Paula, thank you so much. Really thought-provoking. And thank you everyone who joined us and stayed with us. Before you go, two quick things. First, if you're not in our WhatsApp group, come join us. And second, follow us on LinkedIn. That's it. That is it for us. Thank you again. Thank you all. See you.
Thank you so much. And please do share the feedback and questions. I think there were like really good questions that I don't think we have an answer, but we'd love to get into more depth in those questions. So please feel free to reach out to us, and we'd love this conversation to keep going. Thank you. And thank you for joining. I don't know, the person from Melbourne, that it's 1 a.m. there. Thank you for being here.